Now, welcome back to the Oral Health Podcast. Now, obviously, we had quite a really in-depth discussion with Sue and Katie from Marie Curie last week about the changes that our mouths go through at end of life. Today, I want to focus a little bit more on one part of the body. So we've got Dr. Carolyn Hijazi here from the University of Aberdeen and the British Heart Foundation to talk us through heart health and oral health links. A really, really interesting topic. And as we're discussing systemic links this week, really, really vital, and it's good to shed some light on that. So without further ado, I'm going to let Dr. Hijazi introduce herself, and I will speak to you again in a second. Now, Carolyn, do you want to just talk us a little bit through your research?
So my name is Carolyn Hijazi. I'm a clinical reader at the Institute of Dentistry of the University of Aberdeen, and I work closely with other medical disciplines around the School of Medicine, Medical Sciences and Nutrition, and one of those is the Centre for Diabetes and Cardiovascular Sciences. So my research is focused on the study of how bugs colonizing the human body, mainly bacteria colonizing the lining of cavities, how those bacteria interact with the lining of cavities like the mouth, and how they can shift to become pathogenic. And they become pathogenic by causing disease in the mouth, but also by causing disease, by causing inflammation systemically around the body. And that systemic inflammation is essentially really what drives the link between oral bacteria and the plaques that build within vessels that then cause heart attacks, essentially. A specific bug which colonizes the mouths of healthy individuals, but increases in numbers in patients who have gum disease. It's called Porphyromonas gingivalis. It's very well studied for its incredible abilities to hijack the immune system, very sophisticated ability to hijack the immune system, and is really been a prototype for understanding how bacteria can evade the immune system, how bacteria which under certain conditions colonize the body and cause no problems can then alter the fine balance with the immune system and cause serious inflammatory responses that will in turn cause disease locally, but also systemically. And the relationship between this bacterium, Porphyromonas gingivalis, and ischemic heart disease is an example of that. And we are working to strengthen the research and the evidence to support the links between oral health and cardiac health, and hopefully in time see oral health prevention guidelines embedded universally in secondary prevention guidelines for ischemic heart disease patients.
That is absolutely fascinating, and I will admit I haven't flossed this morning, and I'm going to go ahead and do that straight after I leave here, because that's horrifying. Now, can we just have a little bit of a chat about plaque? Because we hear heart plaque and we hear tooth plaque. Really simple question. Are they different things or are they the same thing?
Misleadingly, both called plaques, but the plaques in the vessels are essentially mostly fat deposits, the deposits of fat and immune cells and inflammatory cells, whilst the plaque in the mouth is actually a buildup of bacteria and the environment surrounding the bacteria. Yes, so in answer to your question, they're completely different entities.
Okay, good to know. I had a feeling, but it's always helpful to check. Now, when we think about heart-friendly diet, I imagine there's quite a bit of crossover with a tooth-friendly diet, is that right?
Yes, the crossover between a tooth-friendly diet and a heart-friendly diet is really a healthy diet and an avoidance of foods that will put patients more at risk of very serious problems like diabetes and obesity, which in turn are very well recognized risk factors for both periodontal disease and coronary artery disease.
Oh, good to know. Okay, so one of the things as well, because we're discussing systemic links with the mouth and the rest of the body, is I wanted to have a little bit of chat about how heart conditions can affect oral health, and I guess vice versa, how oral health conditions can affect heart health.
And a lot of research has gone into understanding how periodontal disease affects heart disease. There's lesser research, but some nonetheless, on how heart disease affects oral health, and that's indeed one of the projects that we're undertaking at the moment. So we have recruited a cohort of patients who suffered from a heart attack a couple of years back, and essentially we are monitoring how preventative measures for secondary disease, so for how the package of measures to prevent recurrence of heart attacks can actually impact their oral health, irrespective of any dental care. So there's a lot less known about how cardiac health affects oral health. A lot more literature on how oral health affects cardiac health. Most studies are association studies, in that in a clinical setting it's very difficult, impossible to infer a cause-effect relationship between the two. But what we're doing in our group is trying to understand the molecular mechanisms within the bacteria that switch on that potential of oral bacteria to become atherogenic pathogens. Atherogenic pathogens meaning acquire the ability to accelerate the build-up of plaques and fat deposits within the vessels.
What about then medications? How do heart medications impact your oral health?
So different types of medications regulating blood pressure and really used in patients who suffer from heart disease to lower their blood pressures can cause different types of issues in the mouth. An example is calcium channel blockers, which essentially cause your gums to become bigger, your gums to grow, and plaque control can become a lot more challenging because bugs build within the pockets and the creases of the tissues overgrowing. So that's really the main issue with calcium channel blockers. And then ACE inhibitors, for example, things like Ramipril and beta blockers, which can cause something called a lichenoid reaction. It's a form of inflammation of the lining of the mouth, which in some cases, in a subgroup of people, can cause a lot of pain actually, and interfere with oral functions, and can become very difficult to treat unless the medication is withdrawn. and replaced for another type of medication. So in truth, it's not the biggest problem we have. It can become the issue of the lichenoid reactions, can be a problem for some patients, but there's ways to treat them.
Now, on the topic of medication, Karen, obviously, who normally co-hosts the podcast, she sent me up here with this question about bacterial endocarditis and the medications that you get for that, because it used to be, obviously, it was given as a precaution to everybody, and now the guidelines have kind of changed. Can you talk me through that?
So it's indeed a real concern. Is a really life-threatening condition. The prognosis is very poor. However, it's not common. In the UK, we're reporting an incidence of 3 to 10 per 100,000 people. So is relatively rare, and guidelines. So the guidelines, which largely draw on NICE recommendations, don't actually call for indiscriminate antibiotic cover before invasive treatment. The antibiotic cover is only recommended for a very specific group of people. Namely those who have had endocarditis before, those who have had any valve surgery, and those with congenital heart disease. But even then, the recommendation is to actually liaise with the cardiology team and seek advice on whether antibiotic cover is appropriate.
Okay, now lastly, kind of an important question on the topic of medical history and medical conditions. Why is it important that a dentist has the full picture of someone's physical health as well as their oral health?
Without sounding too dramatic, I would go as far as saying that probably any dentist who doesn't have full knowledge of a patient's medical history and medications should really refrain from providing any dental care, particularly any form of invasive dental treatment, as medical conditions as well as medications can have a whole range of implications. The mouth is a mirror of the body, as they say. Please engage with your dental professional and help them to provide the best quality and the holistic care that you expect to receive, and one that views mouth health in the context of your general health, and be reminded that several medical conditions affect your mouth health and vice versa.
A great note to end on. Thank you so much, Carolyn, for sitting and talking to me. Thank you to British Heart Foundation and University of Aberdeen for making this conversation possible. And I hope that you learned a lot. Next week we're going to be talking about sustainability, so oral health and the environmental impacts. Really interesting stuff coming up, so hopefully I'll see you next week, and thank you for listening.